I'm Dirk Gouma from Amsterdam University, and my first interest for management of complications started in the early 90s. We analyzed all patients with pancreatic cancer and we showed that our mortality was 2%, but unfortunately we had 50% of complications. And I told it to all the surgeons in the Netherlands, and they all mentioned to me, how is that possible? We don't see complications at all. That was the first step, that we realized that we should monitor and have a complication list of what we are doing in the hospitals. And when we had that complications list, we also realized that we had to improve the management of these complications, because when we evaluated our data, we found that if you manage your complications quite well, the mortality will reduce dramatically. And we did some studies, and also in the United States we have some studies showing that there is a correlation between mortality in the hospital and the management of complications. So all hospitals, even the experienced hospitals, have mortality or have morbidity, complications, but the difference in mortality is due to the management of complications. The hospital, the structure of the hospital, and the management of these things. And that's the reason to start with this book, the general management of complicated patients. If there's a complication, how you should go on, how you should treat these complications, and what the institutes should do. So we should also explain how to start with registration of complications, how to register the severity, the different kinds of severity of complications, and the management of those. And in fact, in this book, all these details are summarized nicely. So I think this book is important for junior residents, resident surgeons, but also for people who want to change the hospitals and the intensive care for management of these complications. And I really hope that we will have a lot of people who are using this book in their daily practice, and by that will improve the quality of care in these hospitals. It was a great pleasure to work together with Professor Nundy and to establish this book, and I really hope many people will be involved in this learning process. Thank you so much.